Now, 62 more people have tested positive for the coronavirus in the last 24 hours to bring the national tally to 1,348. Now, let's break it down further. Now, out of the 62 new cases, 59 are Kenyans and 3 are foreign nationals. They're all aged between 6 and 64 years. Nairobi, which is the epicenter of the outbreak, reported 23 new cases. Mombasa has 16. Kwale 8, Kiambu 6, Kajiado 6 and Kitui 3. In Nairobi, the cases are spread out in Umoja, Kibra, Isli, Dagoretti North, Langata, Westlands, Starehe and Embakasi. The government is also concerned that a number of people who've tested positive have been giving out false contact and personal information, making it difficult to trace them and those they've been in contact with and derailing the fight against the pandemic. Now, in the last 48 hours alone, Langata area of Nairobi County has recorded about 25 new infections of the virus. Public health authorities are now raising the alarm, asking those living in the area to be extra vigilant and adhere to the laid down guidelines. The Nairobi Metropolitan Services has also set up mass testing centers to establish the extent of community infections, but the low turnout of people is becoming a concern. Naoma Sampao was there.
The Ministry of Health is racing to keep the number of coronavirus as low as possible with targeted mass testing in potential hotspots. Among the areas with growing concern is Langata, which recorded 21 cases of coronavirus yesterday and 2 more today.
We visited this informal settlement within Langata to assess the uptake of guidelines aimed at containing the spread of the coronavirus. From our observation, it is business as usual. People going about their day-to-day activities. Evidently, social distancing regulations and strict wearing of masks is only a mirage here.
Watu ndugu wanalia mask, hatuna mask. Juu mask ni 100 ama 50 bob. So tuna request government ikuja hapa Undugu itulete mask, anailete mama sanitizer.
Residents are now urging the Ministry of Health to set up more mass testing centers.
Tunaomba sana vile serikali ilikuwa na mwongozo kutuletea hapa vitu ya kupima, ingekuwa vizuri sana tuletee mji wa Undugu. Kwa sababu kutoka hapa na kwenda upande ya yani ati kupata matibabu tunaona ni shida sana.
In the expansive Kibra slums within the constituency, a mass testing exercise is underway. Public health officials say there has been a relatively low turnout of individuals wanting to take the test. For some, the intrusive nature of the testing process is too much to bear.
Watu wajakamu wengi sana, lakini tunaenda kuwatoa kwa kijiji wakuje. Sababu walikuwa wanalia ati kitu ya kupima ni uchungu. Kuna mwingine alikuwa ananiambia ni story refu kama ya soda.
Our target is about 500 people. What we are targeting, but so far I think we are around 120. We will organize for another activity same like this.
I don't want to contaminate them.
Away from the testing centers where health officials and police enforced the guidelines to prevent further spread, on the streets many walked in groups and engaged in conversations with barely no distance between them.
Some of our people have been shy to present themselves for testing for fear of the treatment cost. Let me restate once more. The cost of testing, quarantine, and treatment in a government facility will be fully met by government.
The crowded settlements are said to be at a higher risk of community infections. Naoma Sampao, NTV.